Coronavirus disease, COVID-19, and its control. Most important points to be remembered for coronavirus disease, COVID-19. What is coronavirus disease, COVID-19? It is a communicable disease caused by a newly discovered coronavirus. Mostly people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. How dangerous is COVID-19? Although for most people COVID-19 causes only mild illness, it can make some people very ill. More rarely, the disease can be fatal. Older people and those with pre-existing medical conditions, such as high blood pressure, heart problems or diabetes, appear to be more vulnerable. Is coronavirus a bacteria or virus? The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or a discharge from the nose. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap and water. How does COVID-19 spread? COVID-19 spreads mainly by droplets produced as a result of coughing or sneezing of a COVID-19 infected person. This can happen in two ways: direct close contact. One can get the infection by being in close contact with COVID-19 patients, within 1 meter of the infected person, especially if they do not cover their face when coughing or sneezing. Indirect contact. The droplets survive on surfaces and clothes for many days. Therefore, touching any such infected surface or cloth and then touching one's mouth, nose or eyes can transmit the disease.
Please subscribe our channel, AIM Knowledge Mandira, and press the bell icon.
How can I protect myself and others from COVID-19? Practice social distancing. Avoid gatherings such as meals, hats, gatherings in religious places, social functions, etc. Maintain a safe distance of at least 1 meter between you and other people when in public places, especially if they are having symptoms such as cough, fever, etc. to avoid direct droplet contact. Stay at home as much as possible. Avoid physical contact like handshakes, hand-holding or hugs. Avoid touching surfaces such as tabletops, chairs, door handles, etc. Practice good hygiene. While coughing or sneezing, cover your nose and mouth with handkerchief. Wash the handkerchief at least daily. It is preferable to cough, sneeze into your bent elbow rather than your palms. Do not spit or shout in public places to avoid the spread of droplets. Do not touch your eyes, nose and mouth with unclean hands. Ensure that the surfaces and objects are regularly cleaned. What is the recovery time for the coronavirus disease? We can say by using available preliminary data, the median time from onset to clinical recovery for mild cases is approximately 2 weeks and is 3-5 weeks for patients with severe or critical disease. Can food be contaminated with the virus that causes COVID-19? It is highly unlikely that people can contract COVID-19 from food or food packaging. COVID-19 is a respiratory illness and the primary transmission route is through person-to-person contact and through direct contact with respiratory droplets generated when an infected person coughs or sneezes. There is no evidence to date of viruses that cause respiratory illnesses being transmitted via food or food packaging. Coronaviruses cannot multiply in food, they need an animal or human host to multiply. COVID-19 controlling procedure. Marketplace controls: always wear nose mask or use face cover when you go out of your residence, wear dedicated plastic slippers for the market, make a distance of minimum 3-6 feet from any person or shopkeeper in the market, don't touch anything unnecessarily outside your home. Don't touch your face with your hand when you are outside your home. Keep a small pack of hand sanitizer, containing 70% alcohol, in with you and always sanitize your hands if you feel you touched anything suspicious in the market. Try to keep away the material from your body when carrying from the market. It is better to have a plastic bucket with you when going to the market. Put the material in the bucket and carry it to your home. Go to the market only when it is urgent. Try to go once or twice in a week. How to make payment in market. Try to make digital payment using any digital application like Google Pay, Pay Trademark app, PayZapp or any other bank application. Don't take paper currency from any shopkeeper because it may carry coronavirus. If you give paper currency note to the shopkeeper, then purchase with the whole amount and don't take money back. If in any circumstances you take paper currency from the market, then keep it in your hand until you're home and disinfect it using cloth iron. Iron the currency on both sides. The person visited the market will not touch the iron, he will put the currency note on the surface and other family member will iron. Disinfect the currency coins with 70% alcohol-based sanitizer or soap and water. Wash your hands with soap and water after currency disinfection. How to use of public lift, staircase. In corona pandemic it is better to use the staircase instead of a public lift, and don't touch the staircase with your hands when you come out the lift without touching it from outside, and try to maintain minimum 3-6 feet distance from others in the lift. It is better to use it individually. How to use entrance in home. In situation of corona pandemic, doesn't touch the door. Call house members to open the door when you enter. Put the material at a dedicated place near the door like a table or any box. After using washroom, and wash your hands and face with soap for at least 20-30 seconds. Put off your clothes and dip those in detergent solution and bath with soap. Try to wash your plastic street slipper, footwear properly with detergent solution. How to take stay of the outsider, stranger. If anyone outsider like plumber/electrician/mechanic visits your home, then make sure he doesn't have a fever by using infrared thermometer. Allow him to sanitize his hands with sanitizer or soap and water. Don't allow him to touch anything except his work. Sanitize the place and equipment he used with soap solution after completion of work. How to disinfect, sanitize of your house, home. Initially mop the floor daily in the morning with detergent solution, Nalcal, sodium hypochlorite solution. Disinfect the main door handle and doorbell with 70% alcohol-based liquid sanitizer. Disinfection of kitchenwares are generally cleaned by soap and don't need to disinfect separately. How to disinfect/sanitize of cloths. While after reaching, wash your clothes immediately with detergent when you come from outside the home. Wash your towel and daily used cloths frequently and regular interval. How to do disinfect/sanitize of your hands. Always wash your hands for at least 20-30 seconds with water and soap. Rub the soap on palm, middle of the finger, nails and wrist properly for 20-30 seconds and wash with water. Alternatively, you can use sufficient quantity of the alcohol-based 70% hand sanitizer to disinfect the hands. How to disinfection/sanitize of vegetables and fruits. Nowadays, in current circumstances, it is necessary to disinfect the vegetables and fruits before consumption, and wash the vegetables and fruits with soap, detergent solution by rubbing with hands with clean tap water and store in the refrigerator for use. How to do disinfect of packaged material like milk or any packet. Always wash the packet with soap/detergent solution by rubbing with hand wash with clean tap water. Cut of packet, then pouring into pot and heat to boil, or if you take milk from milkman, then make proper distance during the process and boil the milk immediately, and also follow same procedure with others. How to do sanitize of food material. Unpack food material that can't be washed must be stored at a out place for at least 70-75 hours before its consumption, and avoid purchasing the dairy product from market, and you can prepare sweets and other products at your house. How to do disinfect, sanitize of other items. Always take precaution of non-food items must be stored at out place for at least 70-75 hours before use. How to boost body immunity. We can say this is compulsorily for everyone to improve the immunity these days. Always do the daily practice exercise yogasana, pranayama and meditation for at least 30-45 minutes. Drink herbal tea/a natural catamade from basil, tulsi, cinnamon, dalchini, black pepper, kalamirch, dried ginger, shunt, and raisin, munaka, once or twice a day. Add jaggery, gur, and/or fresh lemon juice to your taste, if needed. If required, take doctor advice. How to maintain clean at working place. Carried out the routine cleaning and sanitization in workplace. The surface, for example, desk, tabletops, door pull knobs/handles, staircase railing etc., and objects, telephones, keyboards, shall be regularly wiped with 70% isopropyl alcohol. 70% type solution dispensers shall be placed at all the identified well-known places throughout the workplaces and shall regularly refilled with hand sanitizer, and personnel shall avoid any close contact that is 2-3 meter or nearer with other people. General information how COVID-19 may spread. When someone who has COVID-19 symptoms such as cough, sneeze or exhales, they release droplets of infected fluids. Most of these droplets fall on nearby surface and objects such as desks, tables or telephone. People could catch COVID-19 by touching contaminated surface or objects and touching their eyes, nose or mouth. All the person shall follow the advisory circulated by firm that people need to stay at home even if they have mild symptoms of fever, cough, sneezing or any of the symptoms related to COVID-19, using mask to cover their face and nose, also to avoid frequently touching their face by hands. Keep on, happy learning. Thank you. Please like and subscribe my channel. AIM Knowledge Mantra.